Okay, Lindsay, so we just got done with our evaluation, but before we move forward, I kind of want to go over the MRI results with you. It looks like your doctor took a look at them and diagnosed you with mild degenerative disc disease. Did he go over
Yeah.
what it is?
No, he didn't.
So basically, degenerative disc disease is just kind of a wear and tear on the discs in between your vertebrae and your spine, which is caused just by normal daily wear and tear. So bending over, walking around, running, jumping, anything involving your spine puts some pressure and moves your discs around, which can cause some wear and tear or degeneration. He said it was mild, which is really common. Most people by their 20s or 30s have degenerative disc disease by some extent. Um, so I'm not surprised to see that diagnosis at all. I do want to talk to you about it a little bit more because I don't believe that is the source of your pain. I think your pain is more of a nerve issue. There's a study done with people, a group of people, half of them had degenerative disc disease just like you, and the other half didn't. And then um, some of those people had pain that you are having too. And surprisingly, the results showed that the the degenerative disc disease didn't have any correlation with the amount of pain that people were having. So that kind of just shows that the the tissue damage in your spine isn't controlling your pain. So I think it is a more of a nerve issue, especially since it's been going on and off for a couple of years and there's not a certain movement or mechanism of injury. Does that make sense?
Yes.
So that's something that we can definitely work on. Just to kind of make it a little bit more clear, there's a metaphor I like to use. So people who have homes usually have like an alarm system that goes off if someone breaks into their house, kind of notifying you that there's danger or there's an intruder and that something should be done. So your body kind of acts the same way. So when you step on like a nail or something, your body will send off this alarm system notifying your brain that there's danger, and your brain will turn on this pain signal, which will cause you to take your foot off of the nail. So I think you're in a state where your nerves are kind of overly sensitive. So it's like your house setting off the alarm every time someone knocks on the door, which is really annoying and unnecessary. So when you touch like the back of your neck and there's pain, or when you massage your neck and there's pain, I feel like that's because your nerves are overly sensitized. So your body is setting off this alarm in your body, notifying you that there's danger and something to worry about when there's not really something to worry about. Does that make sense?
Yeah.
Um, so there's definitely lots of things that we can try and do to help calm those nerves down. You mentioned that just your life, like you're living with your grandma and your finances are pretty stressful, and that when you're in these states of stress, that your pain is worse. Is that right?
Yeah. Mhm.
I think that's something that we should look into. Stress plays a big role into pain, and if we can reduce stresses in your life, then I think that will help reduce your pain as well. Um, we have some contacts next door. There's like some counselors that are really great and have really great advice of how to or help get your stresses out with your life. I think they're great, and that's something I would recommend. I can give you their contact information if you'd like. And then we can also do some like manual therapy. We can do some heat and ice and different things for your neck to help calm those nerves. But I think if we do both those things, then that should significantly reduce your pain. Does that sound like something that you're interested in?
Yeah. Thank you so much.